February 1st marks the beginning of American Heart Health Month, and the Cleveland Clinic has just released the results of one of its latest studies.
Yeah, well, this year's Love Your Heart survey looks into how the pandemic is affecting heart health of all Americans.
So we have Cleveland Clinic cardiologist Dr. Christine Jealous joining us this morning with more on the findings. First of all, Dr. Jealous, thank you for joining us. But I'd love for you to first explain kind of what the clinic's heart health survey really did focus on, because these statistics coming out of it are really startling.
Absolutely. So every year we do this survey as part of our Health Month awareness campaign. And this year we wanted to explore the topic of COVID and heart health and to see if people are still seeking out their usual health services during this pandemic, because we know there's certain issues and concerns that people have in doing that. And we really want to encourage people that they should be still taking care of their heart health, even despite the pandemic.
Why is it so important, talk about, for people not to ignore their symptoms, put off even just their preventive checks and screenings, and also maybe if they're having issues? I think so many people are concerned and they think twice about maybe wanting to get out and go to a hospital or go see their doctor for fear that they'll catch coronavirus.
Absolutely, and thank you for raising those concerns, because I think it's a real issue. When we look at the data from the survey, it shows that around 50% of people who had significant health concerns during the pandemic did not seek out any medical assistance, which is really worrisome. And even more alarming, of our heart patients, 1 in 3 put off taking their medications. As many of us can relate to, between 40 and 50% of people have gained weight during the pandemic, and about a quarter of those have gained more than 20 pounds. So as you can see, the pandemic is really having a significant impact on people's lives. When we look at our heart patients, a lot of those folks are noticing an increase in things like cholesterol, blood pressure, worsening symptoms of dizziness and shortness of breath. So we really want to make sure that people are not afraid to go and have their regular checkups. Prevention is definitely still key, and to make sure that people are confident to come and see us for either their regular checks or if they have any of those symptoms, because we do not want people to develop any long-term issues that could develop into debilitating symptoms or even death.
When it comes to individuals who are suffering from heart problems, what's the main warning? What's the main thing you want to put out there as we deal with this pandemic?
Absolutely. I think the message is, don't be afraid. We're here for you, whether that's in person, through virtual visits, through our emergency rooms. We're taking precautions with personal protective equipment for our caregivers to protect us and you. We're making sure we adhere to social distancing with reduced visitation to keep everyone that safe 6 feet away. And we're doing temperature checks and screening at all our ports of entry into the facilities. So we're really making this a very safe environment so that people can come in for their regular checkups or for a more concerning issue such as shortness of breath, chest pain, features that people may be worried that they're having an acute event.
So there weren't all negative results. So there was some good news that came out of all of this. I know you found some great things, people picking up on exercise and maybe taking more vitamin supplements. So you saw some good in this as well.
Absolutely, and I think we've learned a lot about this. We've learned we can be creative and flexible, and we can still maintain healthy diets and exercise despite the restrictions that we're going through. So we really want to make sure that this is a continual process, that we don't lose these positive attributes that we've gained. And for those who sadly have had COVID, that we do have support for those with our post-COVID cardiovascular recovery program to help them get through some of these heart issues that may have been a development for them because of the pandemic.
All right, all great information. Thank you so much.
Pleasure.
Dr. Christine Jealous, Cleveland Clinic. Boy, great advice, right?
Always do. That's why we're so blessed to have them right here at our fingertips.
We certainly are.